In the summer of 2024, a company called OncogenX was valued at $12 billion. They claimed to have invented a blood test that could detect 17 different types of cancer before symptoms appeared with 99.4% accuracy. The stock was flying. Politicians were praising them. The world's largest pension funds had invested. There was just one problem. By the spring of 2026, that entire $12 billion valuation had turned to dust. The CEO was under house arrest, and the FDA quietly published a report that said, and I quote, 90% of the submitted clinical data appears to have been synthetically generated. This is the story of the Ghost Factory, the most expensive piece of fiction ever sold to Wall Street. OncogenX was founded in 2018 by a charismatic Stanford dropout named Elena Vance. She had a classic origin story, first-generation immigrant, PhD in computational biology, a dead mother from pancreatic cancer. She told every reporter that her mission was personal. She wasn't just selling a test. She was selling hope in a vial. The company's first product was called Sentinel, one draw of blood, sent to their lab in Delaware. And within 48 hours, you'd get a result. The marketing materials said, "Catch it before it catches you." By 2022, they had partnerships with 17 major hospital networks. They had a waiting list of 400,000 patients. They had raised over $3 billion from a who's who of Silicon Valley Sequoia, Andreessen, and even a sovereign wealth fund from Singapore. But here's the detail that got lost in the hype. They had never published a peer-reviewed study. Wall Street doesn't care about peer reviews. Wall Street cares about momentum. In early 2024, OncogenX went public via a SPAC merger. The stock opened at $47. Within 3 months, it hit $290. At its peak, the company was worth more than Ford Motor Company. Analysts called it the most disruptive diagnostic tool since the MRI. CNBC did a glowing profile. The CEO was photographed at the World Economic Forum in Davos. She sat next to a former Secretary of State. She was on the cover of Forbes under the headline, "The Woman Who Will End Chemotherapy, Behind the Scenes." Though, the sales team was under impossible pressure. Internal emails, which we've reviewed, show that regional directors were told to secure hospital contracts at any cost. If a hospital asked for the raw data behind the Sentinel test, sales reps were instructed to say it was proprietary and patent pending. That was the first red flag. In October 2024, a senior biostatistician at OncogenX, named Dr. Marcus Webb, walked into the SEC's regional office in Washington, D.C. He carried a USB drive with 6.4 gigabytes of internal data. He told the SEC that the company's lab had only processed about 11,000 patient samples, not the 110. 000, they claimed. He said that for the tests that were run, the accuracy rate was closer to 67%, barely better than a coin toss. How did they fake 90% of the data, doctor? Webb explained that they used a generative AI model trained on publicly available genomic databases. They basically hallucinated patient results, then backdated the timestamps to make it look like the tests had been run in their Delaware lab. They had a term for it internally. They called it synthetic validation. But there was an even darker layer. The whistleblower also discovered that when the fake tests were sent to hospitals for trials, the company would deliberately cherry-pick the handful of real samples that happened to match the outcome they wanted. They used the fake data to inflate the average, and the real data to provide just enough legitimacy to pass an initial audit. The SEC didn't move immediately. They coordinated with the Department of Justice, and together they executed a joint raid on OncogenX's Delaware facility on February 14th. 2025 Valentine's Day. Agents seized 47 servers. 300 hard drives. And over 1 million pages of internal communications. What they found was staggering. Lab equipment that was so outdated it couldn't physically perform the tests they claimed. A single freezer with only 14,000 patient blood samples, all of which had been drawn after the IPO, not before. And a Slack channel where engineers joked about how the ghost in the machine is doing all the heavy lifting. Within 72 hours, the stock had dropped from $260 to $4.80. Pension funds lost $4.2 billion. 3 major hospital networks shut down their oncology wings because they had bet everything on Sentinel and canceled their traditional screening contracts. By mid-2066, the trial was over. Elena Vance was convicted on 12 counts of wire fraud, securities fraud, and conspiracy. She is currently serving a 17-year sentence. But here's the haunting part. Oncogenix's ghost data is still out there because they used a generative model. They created millions of synthetic patient profiles that were so realistic. They've been accidentally uploaded to several public genomic databases. Researchers at Johns Hopkins recently found that fake data has contaminated at least 3 separate cancer studies, meaning that other real science is now built on top of a lie. The FDA has issued new guidelines requiring raw data submissions for all diagnostic tests. But the damage is done. $12 billion disappeared because a charismatic founder told a story that people wanted to believe, and because Wall Street chose not to ask for the receipt. The Sentinel test was never real, but the human cost was. The investors got a lesson. The patients got delayed diagnoses, and the system got a giant, glowing warning sign that it chose to ignore. The ghost factory doesn't make blood tests. It makes alibis, and as long as we value the story more than the evidence, there will always be another one ready to open its doors. This is the archive. We seal the file